Okay, so the mycobacteria are long and slender, straight or curved rods, and we saw that they acid fast stain red. The M. tuberculosis organism is almost exclusively transmitted within aerosol droplets produced when people cough or sneeze or laugh. Now, I'm not sure, I like to call this the Mann-Tux test, but that's not how it's pronounced. It's pronounced Mann-2. So the PPD skin test that you receive, is that in your way? Are you sure? So the skin test that you receive, it's actually called a Mann-2 test. When you go to take your boards, they like to throw this term around, so associate it with a TB skin test. So actually, a purified protein derivative of the Mycobacterium tuberculosis is in the solution, just a very minimal, and the injection is placed on the forearm, just underneath the skin. It should not go too deep. And what forms when that is injected? A little bubble, and it should form. If that's not there, then it might not have been done right. Okay, so we get this little bubble initially that shows, and then it goes away, and there may be some redness that develops. The wheal, WHEAL, may actually stay there, and that's when something is wrong. So I'm going to look at this little handout right here. The PPD on the forearm, transverse diameter of the induration, not the red part, but the actual bump, the actual wheal. Measured 48 to 72 hours in millimeters. So back when I was working at the hospital, we used to do PP skin tests on the weekends and at nights. So if someone come in, then we would have to go do it. And once it gets in there, you have to go back 48 to 72 hours with some type of little measuring device so you can get the exact amount of wheal. So a positive is greater than 10 millimeters. That's important. Greater than 10 millimeters. Now what happens if you have a positive TB skin test and you don't have active tuberculosis? What did they have you do? They do a chest x-ray to see if there's any GHONs on the x-ray. Okay.
Is there any way to treat it once it's in that
There's a certain cocktail of antibiotics that are given, and may or may not, because the body has sealed it off. So that's kind of usually you'll go through the regimen. So another term that the boards like to use instead of acid fast staining is the Ziehl-Neelsen stain. So associate Ziehl-Neelsen with acid fast. And we used to do gram staining when microbiology was in the program, and so it's kind of interesting to go through the staining process, but we just don't have time to do that now. But like I said, there are other mycobacterium other than tuberculosis that will stain red. And so there's another testing that can be done, and a lot of people like it even better. And well, they'll do a sputum culture too, but I got the stain on my mind. If you'll turn to page 277.
The fluorescent acid?
Yeah, the fluorescent acid fast, and I have not seen one of these, but like syphilis, mycobacterium tuberculosis, when exposed to certain luminous material, it will actually show up really bright and colorful. And so that's another type of stain that can be performed to find mycobacterium tuberculosis. But once it's identified that there is an acid-fast organism in the body, then they're going to do a sputum culture. Now the thing with the sputum culture is that bacteria don't grow overnight. It usually takes days, and with tuberculosis, several days for it to actually grow on an agar plate. Now, when we look at these complexes, it kind of reminds me of a cavity, of an abscess, but what's missing if it was a lung abscess? The fluid level. Usually with an abscess, you'll see an air and a fluid level. With a tubercle, you just see the circle, and there's air in it. Now this is a new test, I don't know how new it is, but it's a newer test that would be performed instead of the PPD skin test, but it's quite expensive. But I will want you to know about it. It's called the QuantiFERON TB Gold test. And it's a whole blood test for use as an aid in diagnosing Mycobacterium tuberculosis infection, including latent tuberculosis infection and tuberculosis disease. This test was approved by the U.S. Food and Drug Administration back in 2005, so it's not that new. So what are the advantages? It requires a single patient visit to draw a blood sample. Results can be available within 24 hours. Does not boost responses measured by subsequent tests, which can happen with the skin test. Is not subject to reader bias that can occur with skin testing. Is not affected by prior Bacilli Calmette-Guerin vaccination. I believe that those vaccinations are, I should have looked that up. But this is really the best way to identify Mycobacterium tuberculosis, but it is expensive. Okay, so this is that picture again. Nothing has changed from this alteration. Consolidation, example pneumonia, but consolidation can also be present with lung abscess. Consolidation can be present with Mycobacterium tuberculosis, and I bet consolidation is going to be present with fungal infections. Okay? So when there is some type of fluid debris inside the alveoli, that is going to affect the VQ ratio. It's going to cause shunting. It's going to cause low PaO2s. It's going to decrease lung capacity and create a restrictive disease. going to lead to fever, lead to sympathetic stimulation, increased rate, PFT findings, bronchial breath sounds, fine crackles, and dull percussion notes over the areas of consolidation. Increased alveolar capillary membrane thickness, we talked about that. The physical exam. Anything new on this? What has to be present for cyanosis? Five grams per deciliter of reduced hemoglobin, aka non-oxygenated hemoglobin. Yes.
Could you say that one more time?
Cyanosis occurs with greater than 5 grams per deciliter of reduced hemoglobin. Now, what is the main culprit of peripheral cyanosis? Vasoconstriction.